Hello everyone, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here we have a group of students who are going to discuss about a condition called cervicogenic headache. They saw a case from our SNS OPD of cervicogenic headache, so they are going to discuss about the case. So tell me some detail about the case.
Female who is 35-year-old, she is an IT professional, came to our OPD department with the complaints of unilateral headache. The pain radiated from the neck to the temporal region. She had increased pain while doing system works and neck movements, and there was no history of migraine or any visual disturbances.
Okay, so on inspecting, the patient will be having some clinical features, no? So what are the clinical features you saw?
The clinical features are neck pain associated with a headache, restricted cervical range of motion, and posture-related aggravation.
Okay.
Differential diagnoses such as migraine and tension-type headache were ruled out because there is no vomiting, nausea, photophobia. The headache is consistently produced. So these findings suggest a strongly cervicogenic headache.
Okay, the clinical features are clear. So let's see on assessment what are the changes they saw during the assessment of the case.
Yes, ma'am. On physiotherapy assessment, the patient showed forward head posture, reduced cervical extension and rotation, tenderness present over the upper trapezius, levator scapulae and suboccipital region. Special tests were conducted, that is a cervical flexion rotation test, and it is to tend to be positive. Task analysis include prolonged sitting, poor ergonomic setup, and sustained neck flexion during the system work. This confirms the diagnosis of cervicogenic headache. There is a severe need for postural correction and cervical spine rehabilitation.
Yes, on introduction itself she said she is an IT professional. So since she had to be in a sitting position for prolonged period working with a laptop, so there was a clear changes in the range of motion, and also the muscles were tight similar to the upper cross syndrome. So this cervicogenic headache is completely because of her professional adaptation to the posture. So let's see what are the physiotherapy management we can do for the case.
The main physiotherapy goal for this case are reduction of headache intensity and frequency, improving the cervical mobility,
Yeah.
and correction of posture, and
Some ergonomic modifications also we can do. We have to suggest clearly. So your professional demand is doing work with the laptop. Since you are doing this work for 8 hours per day, so your posture will be automatically adapted unconsciously to the work. So you will be concentrating only on the work, not in the posture. So hereafter we have to advise the patient clearly to do ergonomical corrections. So what are the ergonomical corrections we can suggest are we can change the eye level of the desktop. So the patient should not do a forward head posture, and also we have to teach some modifications in the hand position, and also we have to give the room for the leg. So leg room has to be there in the computer table. So these are all the ergonomic changes we can do to the patient. And we have to properly teach some of the basic stretches for the head and neck. So those basic stretches of properly 10 times a day during the work time and the break time, so that will give her a good relief from the cervicogenic headache. So these basic corrections itself will give this case a better relief. And what are the exercises we can prescribe for it?
Yes, the patient was advised to do deep neck flexor strengthening exercise, cervical range of motion exercise, scapular stabilizing exercise, and as you said, posture correction and ergonomic progress.
Yes, sure. So we know what are the muscles need strengthening and what are the muscles need the stretching. Those muscles have to be addressed properly, and follow up is needed to the patient. So through a phone call or some messages, you have to check thoroughly for at least 4 weeks or 8 weeks whether the patient is properly doing the stretches and properly doing the ergonomical modifications in a right way. So you can do a follow up. Once you follow up for the 8 weeks, the patient will adapt to the good posture automatically. then the patient will gain confidence about the cervicogenic headache, and the intensity of the cervicogenic headache also will be low in the upcoming session, and the patient will get confidence. Then we can go for the further protocols. So you have to do proper follow-up. So we get to know about the cervicogenic case and the treatment for it and how we can assess the cases. So in further videos we'll discuss about some other cases. Thank you.